So IV therapy. Why does Viva IV therapy exist? Most people think that healthcare is binary. You could either go to an urgent care or you go to an emergency room. But no one talks about the massive gap that's in between, okay? Urgent care is built for speed and volume, and ER is built for life-threatening emergencies. Neither one is designed for early intervention, recovery, optimization, or preventing things from getting worse. And that gap is exactly why Viva IV therapy exists. If you've ever gone to an urgent care feeling run down, dehydrated, sick, or inflamed, and you've probably experienced basically the same thing. You wait, you get rushed, you might get a prescription, and you're sent home hoping that your body figures it out. And if you go to an ER, you're looking at hours of waiting, high cost, and a system that rightfully prioritizes critical emergencies over people who are struggling to function. But here's the truth, okay? So most people walk into an urgent care ER, they aren't emergencies. They're depleted, they're inflamed, they're stressed, exhausted, they're fighting something off, or recovering from something that their body just hasn't bounced back from yet, okay? And that's not an emergency problem. That's a physiology problem, okay? So at Viva IV Therapy, we approach this very differently. We're not a spa. We're not mobile IVs. We can do some though. We're not trying to replace primary care, urgent care, or ER. We're a physician-led medical clinic designed to intervene early, support recovery, and help basically your body function more efficiently before things start to spiral. So every patient is medically screened and every treatment is selected intentionally. And everything we do is medically guided by medical oversight, okay? Because that matters. Because IV therapy isn't just, fluids and vitamins. It's affecting circulation, electrolytes, metabolism, immune response, and cellular energy. That requires medical judgment, and one of the biggest differences between Viva IV therapy and many other IV clinics is how we approach safety and outcomes. We screen for contraindications. We ask about medications. We consider medical history. We monitor patients during treatment. That's very different from places that operate off a menu or basically deliver IVs without any meaningful medical evaluation, okay? That's different from most mobile IV services that don't have the ability to escalate care if something unexpected happens. So healthcare shouldn't be convenient at the expense of safety. So who is Viva IV therapy actually for? It's for people who are dehydrated and run down. They're fighting off illness or recovering from one. They're traveling frequently. They're under high stress, training hard or overworked, experiencing fatigue, brain fog, slow recovery, who don't need an ER but need more than just a go home and rest type scenario, okay? We provide hydration, vitamins, medications in a controlled clinical environment with physician oversight, and we focus on how your body actually works, okay? That's an important distinction. We don't promise miracles, we don't claim to cure diseases, and we don't replace emergency care. But what we do is we support physiology intelligently, conservatively, and medically. And when you support hydration, micronutrients, metabolic function appropriately, the body often does what it's designed to do, recover more efficiently. And that's not hype, that's biology. If you've ever thought, I don't feel bad enough for the ER, but definitely don't feel okay, then that's the moment Viva IV therapy was built for. Not rushed care, not excessive care, medical, thoughtful, physician-led. And at Viva IV therapy, we believe good medicine isn't always reactive. Sometimes it's about stepping in at the right moment before things get worse. And for the right patient and at the right time, that can make a real difference.